This conference will now be recorded.
So we see one by one. What is the location of palatine tonsil? What is the location? In the interior of the pharynx. Already I told you. What is the location? Tonsillar fossa. Where do you see the tonsillar fossa? At the lateral wall of oropharynx. That is the location. Okay. And next we come to the shape of the palatine tonsil. This one is almond shape. That is the shape of palatine tonsil. And now straight away directly now we come to the parts of the palatine tonsil. So we see the first parts in the picture. Then after that we write the notes. So first of all, in this picture, okay, this is the picture A. So first of all, in this picture, we can see the location of the palatine tonsil. With yellow color, I'm showing the one fossa, and this one is called tonsillar fossa. So what are the boundaries of the tonsillar fossa? So apex is formed by softpalate, and base, this one is formed by dorsal 1/3 of tongue, and anteriorly is bounded by palatoglossal arch, and posteriorly bounded by palatopharyngeal arch. So these are the boundaries of the tonsillar fossa. So whatever you see green color inside the tonsillar fossa, that one is the palatine tonsil. Now we see the parts of the palatine tonsil in another picture. So now we are going to see the parts of the palatine tonsil in another picture. So I'm going to download the picture. Now this is the palatine tonsil. We can see here in this picture. So this is the picture 2. Whatever you see, this violet color, this one is the palatine tonsil, PT. Whatever you see violet color. So beside this picture, I'm drawing the shape of the palatine tonsil. So palatine tonsil is present like this. Usually, if you see the palatine tonsil, what are the parts? Upper pole, lower pole, and the two borders, anterior and posterior, lateral surface, and medial surface. So these are the parts of the palatine tonsil. Okay. So if you read the parts of the palatine tonsil, first we start with the two poles. So two poles, those are upper and lower, and two border, anterior and posterior, and two surfaces. These are the parts. So usually upper pole is related to Softpalate. So at the apex of the tonsillar fossa. Lower pole is related to dorsal 1/3 of tongue at the base of the tonsillar fossa. So anterior border is formed by anterior boundary of tonsillar fossa. That one is the palatoglossal arch, and the posterior border is related to the posterior boundary of tonsillar fossa. That one is the palatopharyngeal arch. So if you see poles and borders that I have shown you in the picture A. So upper pole is related to Softpalate at apex. Lower pole is related to dorsal 1/3 of the tongue at the base. And anterior border is related to palatoglossal arch at anterior border of the anterior part of the palatine tonsillar fossa. And posterior border is related to palatopharyngeal fold at the posterior border of tonsillar fossa. That means the boundaries of tonsillar fossa form the relations for two poles and two borders of palatine tonsil. Now we come to the surfaces of the palatine tonsil. So palatine tonsil is possessing mainly two surfaces. Number one, medial, and second one is called lateral. First, we go back to the picture. We try to see the surfaces. So I have written one picture here. So I'm highlighting the medial surface. Whatever you see in this picture, that is the medial surface. If you see medial surface, that is simply lined by mucous membrane of the oral cavity. Anaga stratified squamous epithelium is lining the medial surface. First point. In the medial surface, we can see the number of the crypts. Out of all these crypts, one crypt is very prominent. That one is called tonsillar cleft. So these are the features we can see at the medial surface. Again, medial surface, okay, is formed by and covered by the epithelium of the oral cavity, and it is possessing number of the inward folds. Those are named as crypts. Out of all these crypts, one is the prominent, that one is called cleft. So this is about the medial surface. The same thing we write here. So what we have seen in the medial surface, first we have seen in the epithelium, that is the stratified squamous epithelium. So lining the medial surface, number one, and we can see the 10 to 12 folds are there inside in inward folds. Those are named as crypts. Out of all these crypts, one is prominent, that is called tonsillar cleft. This is about the medial surface. Now we come to the second surface, the main surface. This question and this surface may ask us a short notes question. This one is the lateral surface. Usually, lateral surface of the palatine tonsil is related to tonsillar bed. Tonsillar bed. Now we are going to see the what structures are forming the tonsillar bed. So we go back to the picture 2. So this is the picture 2. Here with the yellow color, already I have shown you palatine tonsil PT. Now we are going to see the Now we are going to see the tonsillar bed. That means lateral surface is related to tonsillar bed. So if you see the lateral surface, okay, in the lateral surface, what we can see, what structures are related to lateral surface from inside to outside. First one, I put in the bracket with the green color. Number one, capsule of tonsil. Number two, paratonsillar vein with the loose areolar connective tissue. Number two, you see in order from inside to outside. And number three, you know, pharyngobasilar fascia. And number four, superior constrictor. Number four, superior constrictor. Number five, buccopharyngeal fascia. And number six, styloglossus muscle. And last one nerve is there. Number seven, glossopharyngeal nerve. So in this picture, I have shown you formation of tonsillar bed. So this tonsillar bed is related to lateral surface of palatine tonsil. So structures forming the tonsillar bed is very, very important in clinical side. So if you want to do the tonsillectomy, that means removal of tonsil, you should aware of the structures related to the tonsil. Then only we can do surgery. So clinically, very, very important. So once again, I'm repeating here, tonsillar bed, 5 marks question. So tonsillar bed is formed by totally 7 structures here. I have shown you. One, capsule. Number two, paratonsillar vein with tissue. Number three, pharyngobasilar fascia. Number four, superior constrictor. Number five, buccopharyngeal fascia. Six, styloglossus muscle. Seven, glossopharyngeal nerve. What I'm telling here, you can see 3, 4, 5. 3, 4, 5 structures. That means pharynx. Yesterday in the dissection already I told you, inside the muscle coat of the pharynx, buccopharyngeal fascia is present. And outside, pharyngeal muscles are covered by, inside the pharynx, we can see the pharyngobasilar fascia. And outside, pharyngeal muscles are covered by buccopharyngeal fascia. So these three structures also we can see at the tonsillar bed. So this is about the lateral surface and its relations. Same thing we write here. So lateral surface is related to tonsillar bed. Then what structures are forming the tonsillar bed here? First one, capsule.
Capsule of the tonsil.
Very good. Second one, paratonsillar vein.
Paratonsillar vein. Areolar tissue.
Number three,
Pharyngobasilar fascia.
Pharyngobasilar fascia. Then what is that muscle? Superior
constrictor.
Number five,
Buccopharyngeal
fascia. Number six,
styloglossus
muscle. Number seven, ninth cranial nerve, glossopharyngeal. So this is about the tonsillar bed. So these are the parts and the relations of palatine tonsil. Now we come to the blood supply of the palatine tonsil. So next one, blood supply. So this is the very, very good picture for the blood supply of the blood supply of palatine tonsil. You can see in this picture. So in this picture, I'm showing you what are the arteries supplying to. What are the arteries supplying to palatine tonsil? First one, facial artery, lingual artery, and external carotid artery, direct branch from the external carotid artery. Okay. And also we can see the branch from the maxillary artery. Branch from the maxillary artery. So these are the structures supplying to, these are the branches supplying to palatine tonsil. Same thing I write in the notes you see here. First of all, tonsillar branch, number 1. So tonsillar branch of facial artery, number 1. Number 2, ascending palatine branch. Ascending palatine branch of same facial artery only. Number 3, dorsal lingual branch of lingual artery. Number 4, ascending pharyngeal artery. Number 5, greater palatine artery. So here you see facial artery, lingual artery. So greater palatine artery is the branch of maxillary artery. These things. Of course, these all are branches of external carotid artery. That means facial artery is the branch of external carotid artery, lingual artery branch of external carotid artery, maxillary artery branch of external carotid artery, and ascending pharyngeal artery direct branch of external carotid artery. So this is the blood supply of palatine tonsil, richly supplied, చాలా ఎక్కువ ఉంటుంది. So mainly facial artery, lingual artery, maxillary artery. Tonsillar branch, ascending palatine branch, dorsal lingual branch, ascending pharyngeal, greater palatine. Is it clear? So this is the arterial supply, and venous drainage through the paratonsillar vein and draining into pharyngeal venous plexus. Pharyngeal venous plexus, because it is present along the lateral side of the pharynx, pharyngeal venous plexus. Then nerve supply. So palatine tonsil is supplied by the glossopharyngeal nerve and also greater palatine nerve. Two nerves are supplying to palatine tonsil. So this is about the palatine tonsil. The most clinical anatomy, commonly palatine tonsil is infected in the children or enlarges. So in those conditions, sometimes we have to remove the palatine tonsil. That process is called tonsillectomy. That is very important. So this is about the palatine tonsil. Is it clear? Again, is it clear?
Yes, sir.
So in overall, we have seen the location, shape, parts, blood supply. So don't confuse here. I used two words. One is tonsillar fossa. Second one is the tonsillar bed. I only take a differentiation chudandi. First thing. And second thing, at the tonsillar bed, the most important structure clinically, that is the paratonsillar vein that is present. Because during surgery, we have to ligate that vein to avoid the blood bleeding. That's the thing. And I told you here, blood supply of the palatine tonsil. Okay. And venous drainage into pharyngeal plexus. And nerve supply along with the pharynx, mainly glossopharyngeal nerve and greater palatine nerve. So this is about the palatine tonsil. Now we move to the second topic. That one is the soft palate. So first show you a picture of the soft palate and then we learn in detail. Can you see this picture?
Yes, sir. Yes, sir.
With yellow color, with yellow color lines, I show you Softpalate. This one. That is the Softpalate. Behind the hard palate, between the oro and nasopharynx. So, if you see Softpalate structure, it is formed by muscles, glandular tissue, and aponeurosis. That's why this one is the fibro-musculo-glandular organ. That is the Softpalate structure. Now we come to the parts of the Softpalate. If you see parts of the Softpalate in this picture I show you, this one is the lower border pre, and this one is the upper border attached to hard palate. And next we come to the surfaces. Two surfaces are there. Okay, this one is the PS, posterior surface. This one is the anterior surface. So these are the parts of the Softpalate. Again, I'm telling you parts of the Softpalate. This is the fibro-musculo-glandular curtain. That is the structure of the Softpalate. Mainly two borders, UB attached to the hard palate, and LB lower border, that is free, present below, and the two surfaces, anterior surface towards the oral cavity, and PS posterior surface towards the interior of pharynx. So this is about the parts of the Softpalate. So now we write down these features. So already I told you structure of the Softpalate. This is the fibro musculo glandular organ or curtain, and we can see the aponeurosis, and we can see the palatine muscles and glandular tissue. So that means ivanni kuda they join to form the one soft organ. That one is called Softpalate. So fibro musculo glandular organ. This is the structure and the definition of Softpalate. So what are the parts of the Softpalate? What are the parts?
Two borders, two surfaces.
Two borders, upper and lower. Two surfaces. So anterior and posterior. So upper border attached to hard palate.
Hard palate.
Lower border free. And it has, in the middle, it has the downward projection. That one is called uvula. Okay. Now anterior border and posterior border. For anterior and posterior surfaces. This is about the parts. Now we come to the main topic in the palatine tonsil. That one is the muscles of palatine tonsil. So the main topic, muscles.
Sir, Softpalate.
Sorry, not short palatine tonsil, short palate. So now we come to the main part, muscles of Softpalate. Muscles of Softpalate. So same picture we try to see for the muscles of Softpalate. So this is the second picture. In this picture, we can see the muscles of Softpalate. I will show you one by one. See here. This is the one muscle, and this is the second muscle. Okay. I use green color. This is the second muscle and two muscles. From below, we can see another two muscles. This one and this one. And one muscle that is forming the at the lower border with the circle I'm showing, that is another muscle. Totally, we can see in this picture 5 muscles. Number 1, 2, 3, 4, and last muscle within the soft palate only. Within the soft palate, that is the 5th muscle. So if you see the number 1 and number 2, both are taking origin from the one common part here. That one is the AT. That one is passing through the sinus of Morgagni, piercing the superior, that pharyngobasilar fascia. AT means auditory tube. Very good. So now you name the two muscles here. Inside the auditory tube, levator,
Levator valli palatine.
levator vellae palatini or levator palatini. Number 1. Number 2, outside the auditory tube, tensor vellae
Tensor
palatini.
valli palatine.
Very good. Similarly, we come to the lower aspect of the palatine tonsil. It's not lower aspect of the soft palate. Here you see the number 3 between the soft palate and tongue. Name that muscle. Palatoglossal muscle. Palatoglossal muscle present deep to the same arch. Palatoglossal arch. Okay, na? That thing. Now we come to the number 4. Number 4 from the palatine tonsil to, so not from the soft palate to pharynx. Number 4 from the soft palate to pharynx. What is that muscle?
Palatopharyngeus.
Yes.
Pharyngeus.
Present deep to the same muscle. And number 5, muscularis uvulae. Muscularis uvulae present inside the palatine tonsil at the lower free margin of present inside the soft palate at the lower free margin. So these are the 5 muscles. 1, 2 above, 3, 4 below, number 5 within the soft palate only. These are the muscles of the soft palate. Now we write down. So number 1, tensor vellae palatini. Number 2, tensor tympani. Levator vellae palatini. Levator vellae palatini. And number 3, palatoglossal. Number 4, palatopharyngeus. Number 5, muscularis uvulae. Muscularis uvulae. So these are the muscles of the soft palate. Is it clear? Okay, number. So muscles of soft palate, 5 marks question. You should write the origin, insertion, narrow supply, and actions of all these muscles. But here you don't have sufficient time. That's why here I explain only one muscle. For rest of the muscles, you go through your books. Okay. Here I'm going to explain very, very important muscle. Occasionally they ask this muscle as a short notes question. That means 5 marks question also. That muscle is a tensor vellae palatini. Okay. So I'm going to explain only one muscle. That one is the tensor vellae palatini. Now we see the detail about this muscle: origin, course, insertion, and a narrow supply, and other things about this muscle. So next we put heading tensor vellae palatini. So first we see in the picture that muscle. Okay, I only draw that thing. For example, here I'm trying to draw this is the posterior border of medial pterygoid plate. It has the process, upward process. That one is called pterygoid hamulus. Above at the base of the medial pterygoid plate, there is a rhomboid shaped fossa. This one is called scaphoid fossa. Then here we can see the medial to that scaphoid fossa. Here we can see the auditory tube. Then this is whatever I'm showing here. This is the free margin of hard palate. At the free margin of hard palate, laterally we can see the palatine crest. These points are required to learn this muscle. Again, I'm telling all the parts. AT, auditory tube. Second one, scaphoid fossa. Number 3, pterygoid hamulus. Next, palatine crest. Of course, this one is the hard palate, free margin, posterior free margin of hard palate. So these are the parts we can see at the norma basalis. Okay, now I'm going to show you origin of this muscle, tensor vellae palatine. So tensor vellae palatine takes origin from the lateral side of the auditory tube, and principal main origin from the scaphoid fossa. Then after that, these fibers are passing downwards along the medial pterygoid plate, reach the pterygoid hamulus. Near the pterygoid hamulus, it is hooking the pterygoid hamulus, take the medial course, and vertical gochi. Here onwards, it takes the medial course. Then after that, it forms the very broad tendon. That one is called aponeurosis. With blue color I'm showing, and this one is attached to the hard palate and also palatine crest. So this is about the origin and insertion of the tensor vellae palatine. Again, I'm telling origin of the tensor vellae palatine. Number 1, auditory tube. Number 2, scaphoid fossa. That is the origin. In its course, it winds around the pterygoid hamulus. This we have to highlight, and direction changes on matic. Then it forms the aponeurosis, and this aponeurosis horizontally present in the middle of the soft palate and attached to number 3, palatine crest, number 4, hard palate. So 1, 2 origin, 3, 4 insertion. In the middle we can see at the pterygoid hamulus course. Okay, so aponeurotic tendon you can see at the tensor vellae palatine muscle. So same thing we write here, origin, auditory tube, lateral side, principal main origin, scaphoid fossa, then course turns medially at pterygoid hamulus. You highlight this one. Then insertion. So near the insertion forms the palatine aponeurosis, and this palatine aponeurosis inserted to palatine crest and hard palate, posterior free border of hard palate. So this is about the tensor vellae palatine muscle. Short notes question, important in exam point of view. And here I want to highlight one more thing. The main fibrous framework of the soft palate is formed by aponeurosis of tensor vellae palatine. Anaga aponeurosis is present at the middle of the soft palate, from which remaining muscles are taking origin. Whatever I told you, levator vellae palatine, palatoglossal, palatopharyngeal, uvulae, these all are taking origin or insertion. Any one of it, either. That means these all muscles are attached to aponeurosis of tensor vellae palatine, that is present in the middle, that forms the main supporting framework of the soft palate. This point we have to highlight. So same thing I will show you in the another picture. Can you see this picture? Can you see?
Yes.
If you see this picture, see here, palatine aponeurosis. I told you, whatever you see in the middle, there I am showing, that one is called palatine aponeurosis, and that forms the main fibrous skeleton of the soft palate. దానికి other muscles attach అవుతాయి. See, from above, tensor vellae palatine, levator vellae palatine from above, and also palatopharyngeus. ఈ రెండు కూడా attached above, పైన attach అవుతుంది. Below, palatoglossus muscle is attached. In the middle, we can see the muscularis vivulae. This is about the soft palate. And in this picture also, we can see nicely pterygoid hamulus, how tensor vellae palatine muscle is winds around the pterygoid hamulus and take the medial course. That also we can see here clearly. So this is about the muscles of soft palate. Okay. So till now I completed. Okay, structure of the soft palate, I told you in the beginning, three structures: fibro, musculoglandular. We have seen the parts, and I list the muscles of the soft palate. I explained in detail about the tensor vellae palatine. Now we come to the remaining things: blood supply and the nerve supply, other things. Okay, if you see the blood supply, what is the blood supply? Any one of you? What is the blood supply of the soft palate? What is the blood supply of the palatine tonsil? Previously cheppanu kada. What arteries are supplying to palatine tonsil?
Facial artery.
Facial artery.
So ascending palatine, branch of facial artery.
Dorsal lingual artery.
Pharyngeal branch of external carotid artery. Then greater palatine, branch of maxillary artery. Greater palatine branch of maxillary artery. So these are the arteries supplying to soft palate. In case of palatine tonsil, we add one more artery. Adintadi lingual branch of dorsal lingual branch of lingual artery. So here I want to clarify one point. For the blood supply of pharynx, soft palate and palatine tonsil, మూడిట్లు కూడా సిమిలరే, సేమ్ బ్రాంచెస్. ఏంటవి? ఫేషియల్ ఆర్టరీ, లింగ్వల్ ఆర్టరీ, maxillary artery, and a direct branch from the external carotid artery, that is the ascending pharyngeal. So దీంట్లో ఎటువంటి కన్ఫ్యూజన్ వద్దు. సో దిస్ ద కామన్ బ్లడ్ సప్లై ఫర్ ఆల్మోస్ట్ సిమిలర్ గా ఉంటాయి. ఒక్క లింగ్వల్ బ్రాంచ్ తప్ప మిగతా అన్ని సిమిలరే. ఫర్ palatine tonsil, soft palate, and including the pharynx also, దాన్ని కూడా ఇంక్లూడ్ చేయొచ్చు. సో venous drainage ఫర్ దీస్ త్రీ, నేను చెప్పిన మూడిట్లు కూడా venous drainage is also common. అదేంటది? pharyngeal venous plexus. This is clear. Now we come to the narrow supply of the soft palate. What is the narrow supply of soft palate? Motor branches are coming from 10th cranial nerve. So cranial part of 11th cranial nerve is passing through 10th cranial nerve and gives rise to motor branches. Sensory branches from 9th cranial nerve. then other branches ante sympathetic from superior cervical ganglion, parasympathetic through pterygopalatine ganglion. Got my point? Indukani why we are included the autonomic nerves here? Because in the structure already I told you, this is the fibromusculoglandular. I mentioned glandular part. Glands are usually supplied by autonomic nervous system. Is it clear?
Yes, sir.
So this is the nerve supply. Simple ga దీన్నే మనం ఏమంటాం ఆల్మోస్ట్ అంటే pharyngeal plexus. Pharynx లో చూశారు కదా. Have you seen in the pharynx?
Yes, sir.
Yes, sir.
అనగా నెర్వ్ సప్లై ఈజ్ ఆల్సో కామన్ ఫర్ దీస్ త్రీ. నేను ఏ మూడైతే చెప్పానో ఆ మూడింటికి నెర్వ్ సప్లై కూడా కామన్. వీటికి ఫారింగ్స్ కి, సాఫ్ట్ ప్యాలెట్ కి, పాలటైన్ టాన్సిల్ కి. ఈజ్ ఇట్ క్లియర్ ఇప్పుడు? అంటే ఇన్ కేస్ ఆఫ్ పాలటైన్ టాన్సిల్ నో మోటార్ సప్లై, ఓన్లీ పాలటైన్ బ్రాంచెస్ ఉంటుంది, అది సప్లై చేస్తుంది. అంటే క్రేనియల్ నెర్వ్ సప్లై చేయదు అనమాట. అది ఎక్సెప్షన్ తప్ప రిమైనింగ్ అన్ని కూడా కామనే. సో వాట్ ఐఎమ్ టెల్లింగ్ దట్ arterial supply, nerve supply almost similar for pharynx, soft palate, palatine tonsil. Is it clear?
Yes, sir.
అయితే here one exception. All muscles of soft palate supplied by the pharyngeal plexus, అనగా branch from the vagus nerve. That branch is nothing but cranial part of 11th cranial nerve, except one muscle. What is that muscle? First muscle only. What is that exception? Tensor
Palatine.
This is supplied by mandibular nerve. Why it is supplied by mandibular nerve? Why? What is the reason? Why tensor vellae palatine is supplied by mandibular nerve? Because this muscle is developed from the first pharyngeal arch. The nerve of the first pharyngeal arch is the mandibular nerve. Is it clear? So this one is the oral question. What I told you here, this one is the oral question. Is it clear? And here I want to add one more thing also regarding at this point only. In head and neck region, mainly some group of muscles are supplied by similar nerves, exceptions one. For example, all muscles of soft palate supplied by pharyngeal plexus, except one muscle. What is that muscle? Tensor vellae palatine. That's the one. Alage all muscles of tongue supplied by 12th cranial nerve, hypoglossal, except one muscle.
Palatoglossus.
Very good. Palatoglossus. This is supplied by pharyngeal plexus. ఇప్పుడే చూసాం కదా. Tensor vellae palatine supplied by mandibular nerve. Number 3, all muscles of pharynx supplied by pharyngeal plexus again, except stylo-pharyngeus, glossopharyngeal nerve. Alage all muscles of larynx supplied by recurrent laryngeal nerve, except cricothyroid. This is supplied by
Internal
external laryngeal nerve, that is the branch of vagus nerve. Amma, this one is the oral question in the exam. In head and neck region, okay, group of muscles are supplied by same nerve or same plexus. One exceptions are there. ఇక్కడ నేను 4 groups చెప్పాను. Soft palate, pharynx, tongue, larynx. These all are muscles. You know, all muscles of soft palate and pharynx both are supplied by what are those plexus? pharyngeal plexus. రెండిటికి కూడా కామన్ నెర్వ్ సప్లై. నేను చెప్పాను కదా, ఇంక్లూడింగ్ ది palatine tonsil also. Blood supply, nerve supply almost similar అన్న. So all muscles of short palate supplied by pharyngeal plexus except tensor vellae palatine, that is supplied by mandibular nerve. Like that, all muscles of tongue supplied by 12th cranial nerve except palatoglossal muscle glossus supplied by pharyngeal plexus. Just now we have seen. All muscles of pharynx supplied by pharyngeal plexus except stylopharyngeus supplied by 9th cranial nerve because developed from 3rd pharyngeal arch. Last one, all muscles of larynx supplied by recurrent laryngeal nerve except cricothyroid, that is supplied by external laryngeal nerve branch of the 10th cranial nerve. Is it clear? So this is about the soft palate. Clear amma? Inka doubts unnaya? Any doubts? So regarding the soft palate, one more is there actually that I will write here. That one is the Passavant's ridge. Passavant's ridge. So what is the Passavant's ridge? Once you go through your book, if you have any doubt, you ask me in the dissection hall.